Hello, my name is Katrina. I'll be your student nurse for today. May I please have your name and birthday?
Blake Evelyn, December 2, 1994.
Okay, Evelyn, so today I'll be here to administer some medications through your IV infusion. I have 2 ordered here for you. May I please know if you have any allergies to begin with?
Just penicillin.
Penicillin. Okay, so the 2 things I have here for you are your normal saline, which is going to be through a continuous IV. It will help you with your electrolytes, filling it up, making sure you're hydrated at all times. We also have ceftriaxone for 1,000 milligrams for 50 ml through your IV piggyback, which will basically help prevent any bacterial growth in your body, as well as treat any kind of bacterial infection you already have. Some side effects of ceftriaxone also include maybe some swelling on the site, as well as redness, nausea, diarrhea, vomiting, and kind of similar with normal saline, you might also have symptoms of diarrhea, nausea, and vomiting. So if you do experience any of these symptoms, please let us know and we'll help you with that right away, okay? So I'll be right back to check to get your medication and making sure you get everything, okay?
Okay, thank you.
I'm gonna lower it. Okay, so I'm in my med cart and I'm gonna try to get everything that I need. So first is ceftriaxone, which is this one right here. I'm making sure it's 1,000 milligrams for 50 ml. Okay, and ceftriaxone, I'm checking for DICE, which is the right drug, ceftriaxone. I'm checking for the color and clarity. Okay, I'm checking for expiration date as well, and it is 2022. And lastly, I'm going to check for any kind of drainage, making sure everything's intact. There's no holes or anything on here. Perfect. Okay, and now I'm going to check the normal saline. Here I have the normal saline bag for 1,000 ml, exactly what I need. Sodium chloride. Okay, I'm also going to do the same thing, making sure it's the right drug. And comparing with my MAR, I'm making sure everything's intact, there's no holes, nothing, no drainage. The right color, it's clear, and also expiration date, it's 2028, so I can still use this bag right here. I'm also going to take every other tool that I need, my clamp, alcohol pads, and everything else. Okay, so I'm going to go ahead and go back to my patient. Hello again, my name is Katrina. I'll be your student nurse for today. May I please have your name and birthday?
Blake Evelyn, December 2, 1994.
So I was here earlier to state that I was going to give your IV infusion for today. I have 2 medications here for you, but first, do you have any allergies I should know of?
Penicillin.
Penicillin. Okay, so I have ceftriaxone ordered for you, as well as normal saline through a continuous IV. I have a medication here on the table. So first thing I'm going to do is just go ahead and wash my hands real quick. All right. Go ahead and set up my medication. I'm going to take the normal saline. Alright. I'm going to go ahead and make sure it's the right one again. Okay, I'm going to get my gloves.
I'm going to also go ahead and label the sample.
I'm going to go ahead and spike my normal saline bag. Just going to go ahead and spike it. Okay, make sure it's upside down so nothing drifts out. And I'm making sure this is clamped as well. I'm also going to now check for air bubbles, making sure the fluid will run through smoothly. Unclamp one of them here. And then I can see that it's running here. And it's also dripping down here. I'm checking once more. Doesn't seem to be occluded. So I'm going to make sure this bag is filled halfway. Okay, so I made sure this is flowed halfway, and I already checked for any kind of air bubbles and made sure everything could flow nicely. So now I'm gonna go ahead and put my system on. Do yes, new patient. Yes. And 1, 2, 4. Okay, I'm gonna select channel A. Just gonna do basic infusion, and I want my rate to be 100 milliliters per hour, and I want that to run. It's 1,000, so I want to do 900, so it will alert me when I'm about to run out. Okay, and start. Okay. Alright, making sure this is now open, and I see it dripping down here as well. Alright, so making sure it's going. Get the ceftriaxone. 1,000 milligrams for 50 ml. I'm gonna get my tools here as well. Okay. Alright, I'm gonna go ahead and spike this. Making sure it's closed.
And also that's also going to be compressed for bladder. So if you're not familiar with annual catheterization, it is a basic procedure and it can be appropriately painful. However, I'll do my best.
Alright, and then I have my alcohol pipette. Take this off.
I'm gonna let the expose the area.
I'm gonna wipe this.
And while I'm doing this,
So I'm gonna go ahead and wipe this part right here.
and before I do so, my sterile tools and performance to like reassuring
I'm gonna go ahead and touch this now.
and I will you can just type area from cleanest to using the different
Now I'm gonna go ahead and open the port, checking, let it backflow. It's running there, it's also running through here. I'm gonna make sure there's no air bubbles. Alright, it's running pretty smoothly on this one too. So I'm gonna close that up. Hang this here. I'm gonna get my tool here to hang this one, or the primary, lower than our secondary one. I would hang this lower so that it would completely stop and have the ceftriaxone run instead of it, right? And the ports from here. So on my second the channel select, I'm going to do secondary infusion, AD, C, and ceftriaxone, and we want the 1,000 milligrams for 50 ml. Yes, and right, I'm going to confirm and making sure it's the right one that I want. 100 ml, 30 minutes. Okay, I'm going to start that. And now we're going to go ahead and open this one up. I'm also going to open the one down here. Checking to see if it's dripping. Alright, and down here it's dripping as well. No air bubbles or anything. Alright, so I'm just going to leave that to run. I have all the medication set up already. I have both of your medications set up today, your normal saline and ceftriaxone. Do you have any further questions for me?
No.
Oh, okay. So in about 30 minutes, your medication should finish running through, and then if you have anything that comes up, just make sure to press your call light here. We'll be back to assist you, okay?
Okay.
All right. Thank you. I'm gonna wash hands. And then I'm going to go ahead and just document on my MAR the right time that I administered my initials and anything else that happened during the giving of the medication. Okay? And I will leave the room.
Okay, I already washed my hands. Knock, knock. Hi, I'm Tim. I'm your student nurse for today. Can you please verify me your name and date of birth?
Evelyn Blake, December 2, 1994.
Okay, it matches my MAR. Okay, Evelyn, so I'm here to insert a catheter in you because your doctor has ordered it. Is that okay with you?
Yeah?
Okay, great. So, have you ever had this procedure before?
No, not really.
No? Okay. So, I'm going to insert a tubing within your urethra meatus, so that's where you urinate out of. You're going to feel some pressure and a little bit of pain, but that is normal. But please let me know if you're experiencing excruciating pain, and then I'll try to insert it in more smoothly. And do you have any concerns or any questions about this?
No, not really.
No? Okay. So I have my supplies in the room already, so I'm gonna go ahead and grab it, okay?
Okay.
So I'll just put it here. I'm gonna raise the bed up to a working position. Okay, Evelyn, so is it okay if I reveal your perineal area?
Go ahead.
Okay, thank you. So, put Sam's position. I would put on my clean gloves and I would give her perineal care before I insert the catheter. Grab 1 inch of this. I'm gonna go ahead and put on my sterile gloves.
Alright, can you just break with me for a second? Okay, so now we can get started.
Okay, ready?
Let's go ahead and just lower primary line. Start over? I'm gonna edit that. You know it takes me too long to edit? How would I edit that in? I could just keep filming. Film like yeah, I didn't plan it.
Oh, and then in here.
The 10th and the 11th for 2 hospitals, and the 17th and the 18th at another hospital.
Alright, so let's go ahead and do that in 30 seconds. Okay, now we can go ahead and start it on attaching the secondary line. The first thing we do is go ahead and
Throw this away.
So we know it.
So just one rotation, one cohort, yes, one cohort dentist going to do that. Okay, so you're still going to.
Yeah, it's happening.
So are you all going to the same hospital both days, or I heard that you were doing 2 hospitals, same hospital?
go ahead and just do our checks. We're going to confirm that it's ready now.
Have you guys
Go
been
ahead and make
talking
sure it's ready to
anything
drug.
about the upload of the clinical chemical exchanges that's happening?
Yeah, like how there's new requirements that they have to do.
How to do.
Go in the bag and
You've been told that it's
already.
required.
Like
It's not, well, yeah, you can't just
And
go
that's
on
right.
because I went on and paid to go on this.
Okay, so now I will
And,
clean
I was there
with
all
these
night, I was
swabs.
working last night on it, and I was like so mad, because I have this semester.
So this is now going to be my 30 hand, so I'm going to spread the labia. Clean on the side first, so from front to back, throw this away. It's the other side now, front to back, throw this away. Now in the middle, front to back, throw this away. Okay, so now I'm going to insert the catheter in.
So nobody's back.
So, Evelyn, so can you breathe in for me now? Okay.
It's like I've worked here for 30-something years.
Let me know if there's any pain.
And they're like, anyway, so we're trying to see if cancer branch, Marla's trying to see if cancer branch will give where.
Urine's coming out.
So urine's coming out now, so I'm gonna go ahead and just put 1 more inch in. Okay, entered in 1 more inch in. So now I'm gonna inflate the balloon with 5 milliliters of this liquid. Okay, so now I'm gonna give it a little tug to see if it's placed, and it is placed. I would have a stat lock, and I would put it around her inner thigh right here. Okay, so now I'm gonna place the urine bag below the bed. But I'm gonna switch to clean gloves. So throw this away. Put on some clean gloves. Okay. So I'll place it right here.
Y'all didn't lie about any of it.
And I would grab my sticker, and then I'll put name, date, time, my initial, and place it on the bag here. And then I'll also write it here actually. And then I would dress her up, clean my station. Okay, so it's been 3 days, so now I'm gonna take out the catheter. So I'm gonna put on clean gloves. Okay, so first I would get a sample of the urine. So I have my cup right here. So I would grab this. Okay, so now put this in here. Okay, make sure it fills up, and then it reaches 12 milliliters. I'll stop now. Okay. I'll place it back in. Now I'll cap this, put name, date, time, and my initials. And then I'll send this to the lab. I'm gonna deflate the balloon. So I'm gonna take out the water. Okay, and then I took it all out. So now I'm able to get this catheter out smoothly. So Evelyn, let me know if you feel any pain. And then I'm gonna just take it out. Take it out slowly. Okay. And then I will dispose of everything here. I would give her, so after I clean my station up, I would again give her perineal care just to make sure that is clean. Yeah, I'll clean my station and then I'll put her into a normal position, cover up, and then I'll make sure she's okay. Okay, Evelyn, is there anything else you need?
No, not really.
No, okay. So I'm gonna go ahead and lower her bed to her to the lowest position. Okay, I'll make sure the bed is locked, and then I'll wash my hands and then go get my supplies after I cleaned up.